Hi, this is the demo of the M-Health car presented by Yu and Yanchi from Johns Hopkins Carey Business School Healthcare Management Program. We designed a new Lyft service to help resolve the Blue Cross pharmacy desert and transportation desert issue. Our philosophy is to have people in the desert area to have mobile pharmacies. The pharmacy doesn't have to be fixed in a zip code. The idea is to build a mobile pharmacy through the back trunks of the cars. Why we have this idea? So we have this idea just by thinking about what will be commonly found in the pharmacy deserts. What can we see in the pharmacy deserts? We can see fast food restaurants, gas stations, and perhaps cars passing by. And I think the most things that we see the most may be the cars that are passing by us. So we generate this idea that putting the pharmacy into the mobile cars. So what is the M-Health car? We designed this car, which is the Lyft cars with M-Health logo, and it has mobile medical consultation, mobile pharmacy, and nutrition takeaway. So you may want to ask, how to put pharmacy into the trunk? Because CVS is large and the trunk is so small. It is impossible. Now, let me explain in more details. First, we use the big data from the CHM hub to match trunk with drugs according to the zip code. We would distribute medicine based on health determinants such as commonly used drugs, income, weather, living habits, and health status of the people at a specific zip code. Second, we would use Lyft's current data and operational mode to find multiple cars driving in nearby zip code so that they can work together, each have one section of drugs from the pharmacy. Now let's look at how it works. Each Lyft car in nearby zip codes contain one or two aisles of the drugs in CVS so that they each have a section of the pharmacy. Perhaps 5 of them can be the whole CVS pharmacy, but in mobile form. We will use large and extra large cars such as trucks to be the refilling car, which contain almost all the zip code drugs from different pharmacy. And whenever the delivering M-Health car runs out of medicine, it can reach to the refilling M car to fill up. Of course, it can also go to the pharmacy, CVS, or Walgreens nearby to fill up as well. So what technically M-Health car has? First, it has a pharmacy trunk with commonly used drugs matched by zip code. Then it has a tablet for online consultation and drug ordering process. And what does it look like? Maybe we can see a green signal on the top ceiling, or it has the M-Health and Lyft label on the front window. What can we do in the M-Health car? You can consult a doctor or a pharmacist. And you can also get drugs by simply clicking the tablet in the M-House car. If you see an M-House car, how to use it? Now let's go back to the 20th century. You just hail the car when you see the signal. Since you are in the pharmacy deserts, you may not get access to network, and you may not even have smartphones. So all you need to do is just hail in the car, and the M-House car will stop to serve your pharmaceutical need. When you wave to stop the car, the driver will stop immediately. You can tell the driver what you need, or just type or with voice input into the tablet on the car on every language. Then you move to the next step. If you need non-prescription drugs, it will be extremely quick. You just need to confirm your order, and the driver will click on the order on the tablet. Then you can pay by cash or credit card. If you already placed an order online, you can also give the driver the printed receipt to get the drugs. If the drugs you need is prescription drugs, to ensure your safety, you need to go through the tablet online consultation. The driver will help you to consult online with a doctor or pharmacist. You need to tell them your symptoms and needs. If the doctors prescribe you the drugs, you can go through the payment procedure as well. Once the payment goes through, the drivers will use his fingerprints to unlock the trunk, and the trunk will be open. You can get the drugs, as well the printed receipt and the medication notes. Then the drivers will continue to send other passengers. Here you may think, what? Other passengers? Yes, of course. Does the M-House car only do the drug delivery? Absolutely no. M-House cars have all the functions which Lyft and Uber have. You can order a ride or delivery, but what is new about this is that you can share a ride with a trunk of drugs and save your money. Isn't it cool that you don't need to share a ride with strangers but still get a lower price or much, much lower price? Any other good things from using M-House car? Absolutely a lot. You can get lower price when you use Lyft M-House car. When you go to Walgreens or CVS, just scan your Lyft code and get discounts every time you purchase. You can also save money in Blue Cross insurance and free health plans designed for you as a gift. The pharmacy is to go to the health vending machine. It can be found in fast food restaurants, gas stations, or other infrastructures nearby. It is a vending machine which contains drugs that have already been ordered. You can order the drugs using your app, website, text message, phone call, or online customer service. And you can also order your drugs just by telling the staff in the fast food restaurants, gas stations, or even just in the restrooms. When you have already taken your order, the M-Health drivers will deliver your drugs to the health vending machine on the hourly basis, and they will put your drugs into the vending machine, and then you can go to the vending machine to get the drugs. When you get to the health vending machine, you can scan your code or enter the order number to get your drugs, and you can also track your drugs on the phone, websites, and even on the vending machine. So now let's turn to the third function, the nutrition home delivery. There are three kinds of nutrition home delivery. The first is the one delivered by the dietitian choose meal. We choose the meal that dietitian choose for you, so you can eat a healthy meal. We choose the meal based on the zip code and your eating habits and lifestyles. And second is a semi-finished meal, which can be cooked easily. We get the fresh ingredients from the grocery stores and supermarket. And the third one is customized nutrition meals, which you can choose what you like, and it will be cooked well for you. We can have this service because we will partnership with the restaurants, grocery stores, and supermarkets. Since we're out of time, so if you want to know more details, you can email us at xyu51@jhu.edu and ygu29@jhu.edu. And trust me, it is another great plan.